The following information is provided for employees of the Edinburgh School District. Recent revisions to Board Policy DBB Local have resulted in changes to the Edinburgh School District Employee TB Prevention Program. The policy changes now reflect the latest guidelines established for public schools by the Centers for Disease Control and Prevention and the Department of State Health Services. State and national health experts no longer consider one-time mass TB skin testing for new employees as an effective way to prevent TB. Therefore, ECISD will adopt the current recommendations. Employee TB prevention will now focus on education, awareness, and targeted tuberculin skin testing. As a result, all new employees will now be required to complete a TB questionnaire. The responses to the questionnaire will determine whether the employee will be required to obtain a tuberculin skin test. Furthermore, to expand the knowledge base of the staff regarding this disease, all current employees will undergo an annual TB awareness in-service. The following is that presentation. The following information is on tuberculosis and is taken from the Texas Department of State Health Services Frequently Asked Questions about TB. What is TB? Tuberculosis is a disease caused by germs that are spread from person to person through the air. TB usually affects the lungs, but it can also affect other parts of the body, such as the brain, kidneys, or the spine. A person with TB can die if they do not receive treatment. What are the symptoms of TB? The general symptoms of TB usually include feeling ill, weak, unexplained weight loss, fever, night sweats. The most common type of TB, TB of the lungs, also includes coughing, chest pain, and coughing up blood. Symptoms of TB disease in other parts of the body depend on the area affected. How is TB spread? Well, TB germs are put in the air when a person with active TB disease of the lungs or throat coughs, sneezes, speaks, or sings. These germs can stay in the air for several hours, depending on the environment. Now, persons who breathe in the air containing these TB germs can be infected. What is the difference between latent TB and active TB disease? Well, let's start off with latent TB infection. People with latent TB infection have TB germs in their bodies, but they are not sick because the germs are not active. These people do not have the symptoms of TB, and they cannot spread the germs to other people. However, they may develop TB disease in the future. They're often prescribed treatment to keep them from developing TB disease. You may know someone, or perhaps even yourself, who's had a positive TB skin test, but a doctor has told you or them that they are free from tuberculosis. These people have latent TB. Active TB disease, on the other hand, are people who are actually sick with tuberculosis. These germs are active in their body and are multiplying and destroying tissues in their body. They usually have symptoms of TB disease. People with active TB disease of the lungs or throat are capable of spreading germs to others. They, too, are prescribed drugs that can treat TB disease. What should I do if I've spent time with someone with latent TB? A person with latent TB cannot spread germs to other people, and you do not need to be tested if you've spent time with someone with latent TB infection. However, if you've spent time with someone with TB disease or someone with symptoms of TB, you should be tested. What should I do if I've spent time with someone with active TB disease? People with active TB disease are most likely to spread germs to people they spend time with every day, such as family members or co-workers. So if you've been around someone who has active TB disease, you should go to your doctor or your local health department for tests. How do I get tested for TB? There are two tests that can be used to help detect TB infection, a skin test or a TB blood test. The tuberculin skin test is performed by injecting a small amount of fluid into the skin in the lower part of the arm. A person given the tuberculin skin test must return within 48 to 72 hours to have a trained healthcare worker look for a reaction to the arm. The other test, a TB blood test, will measure how the patient's immune system reacts to the germs that cause TB. Of these two tests, the most common is the tuberculin skin test. What does a positive skin test mean? A positive skin test for TB infection only tells that a person has been infected with TB germs. It does not tell whether or not a person has active TB disease. Other tests, such as a chest X-ray and a sample of sputum, are needed to see whether the person has active TB disease. What is a BCG? The BCG is a vaccine for TB disease. BCG is given in many countries, including Mexico, but is not generally recommended in the United States. BCG vaccine does not completely prevent people from getting TB. It may actually cause a false positive skin test. However, persons who have been vaccinated with the BCG can be given TB skin tests or other blood tests. Why is latent TB infection treated? If you have latent TB infection but not active TB disease, your doctor may want you to take a drug to kill the TB germs and prevent you from developing TB disease. The decision about taking treatment for latent infection will be based on your chances of developing TB disease in the future. Some people are more likely to develop TB than others. This includes people with HIV infection, people who are recently exposed to someone with TB disease, and people with certain medical conditions. How is active TB disease treated? TB disease can be treated by taking several drugs for 6 to 12 months. It's very important that people who have TB disease finish the medicine and take the drugs exactly as prescribed. If they stop taking the drugs too soon, they may soon become sick again. If they do not take the drugs correctly, the germs that are still active may become resistant to those drugs. TB that is resistant to drugs is harder and more expensive to treat. In some situations, staff of the local health department may meet regularly with patients who have TB to watch them take their medication. This is called direct observation therapy, or DOT. DOT helps the patient complete treatment in the least amount of time. Do all new students in Texas still need a tuberculin skin test? The answer is no. A TB questionnaire used to identify children at high risk for TB has been developed by pediatric and public health experts working with the Texas Department of State Health Services. This change took place more than 15 years ago. This questionnaire should be used to determine if a child should be evaluated for TB. Children who have a positive reaction to a TB skin test but no symptoms of TB disease should not be kept out of school while they're being evaluated for treatment of latent TB. The American Academy of Pediatrics does not recommend routine tuberculin skin testing of children with no TB skin risk factors for school entry, daycare attendance, WIC eligibility, or camp attendance. How about employees? Do all employees of Texas schools still need a tuberculin skin test? No. There is no statewide requirement for teachers or other school employees to have a tuberculin skin test. As a matter of fact, the Centers for Disease Control and Prevention discourage the use of TB skin tests for persons who have no risk factors for TB exposure. There are people who have had positive skin tests and have been asked to get chest x-rays. Are routine chest x-rays recommended for persons with a positive TB skin test? The answer is no. People with positive skin test results should not have repeat chest x-rays performed routinely. A person with a positive or newly positive TB skin test should receive one chest x-ray to exclude a diagnosis of TB disease. Afterwards, repeat chest x-rays are recommended only if symptoms of TB develop or a new exposure to tuberculosis is reported. Are correctional facilities in Texas required to screen inmates and employees for TB? That answer is yes. Texas Law Chapter 89 of the Texas Health and Safety Code states that correctional facilities must screen all inmates for TB by the 7th day of incarceration and then annually thereafter. They must also screen all employees and volunteers at pre-employment and annually thereafter. The law also requires that all correctional facilities in Texas report to the Texas Department of State Health Services the release of inmates being treated for TB so that the health department can arrange for continuity of care. How often can TB skin tests be repeated? There is actually no risk associated with TB skin tests. If a person does not return within 48 to 72 hours to have a TB skin test read, a second test can be administered as soon as possible. TB skin tests that are positive reactors, however, should not be repeated. Thank you. If you have further questions, you may contact your school nurse or the health service.